The Masai, Samburu and Turkana tribes of northern Kenya are largely nomadic, travelling across huge areas of arid countryside in search of water and grazing for their cattle. There are few roads, no electricity or water supply, and few health facilities. Mobile clinics run by the trusts reach the most remote communities on foot, using camels to transport medical supplies. Each team consists of a nurse, counsellors and camel herders. Routes are pre-planned to ease resupply, but are flexible to meet the needs of the communities who are rarely in the same place month after month. The Trust has up to 3 clinic teams out at any one time, visiting 25 communities each trip when funding permits. The team walks for a month, stopping whenever they find a community or people who need their services. The clinic will try to revisit the same communities every 3 months to coincide with the 3-month duration of the most common family planning method and the HIV testing window period. Locked boxes carry large amounts of drugs to treat whatever ailments the nurses find. Half of all the cases seen are respiratory diseases, including pneumonia.
The disadvantages is we can't carry each and every drug around with us because we don't have enough room. The other thing is about drought. This drought makes a lot of differences with nomadic community because some of them they come complaining of hunger. Sometimes instead of asking for medicine, they ask for food.
At each stop, the nurse will offer consultations and treatment or will refer more complicated cases to other health facilities. Other important services include family planning, HIV counselling and testing, and child immunisations. Here, the nurse is conducting a rapid test for malaria in the child's blood. Malaria accounts for 1/5 of the cases seen by the clinic nurse each year. These are mostly young children who suffer the worst effects, such as severe anemia, coma and death, if not diagnosed and treated quickly.
When I asked the mother, she said she's given local treatment. So for us, it's a sign of the liver has been affected maybe, and the spleen.
Traditional healers are trusted and respected by the community, are always available and tend to be the first point of contact for sick people. In some cases they may help, but in others they may do more harm. The trusts are now working with traditional healers to gain their respect and teach them to recognise danger signs which need professional medical attention. The counsellors will visit people in their homesteads to counsel one-to-one in a relatively private setting. This tactic has increased the uptake of HIV testing and family planning tremendously, allowing more people to discover their status and access family planning methods, HIV care and the life-prolonging antiretroviral drugs from the Ministry of Health. The clinics now test 7,000 people each year.
I'm doing hard work here because he doesn't know anything about HIV and AIDS. He's thinking that even the camera is the one who is testing, so I'm trying to explain it.
There is still a massive lack of information, widespread myths and misconceptions about HIV/AIDS and family planning, so the counsellors' work is vital for the communities. Very few girls are lucky enough to ever go to school in these communities. Consequently, knowledge and understanding of health and disease is extremely low and is a huge barrier to reducing fertility and disease. The clinic team work extremely long days, rising before dawn to break camp, pack the camels and walk up to 6 hours in the heat of this arid land to reach their next site. The camp among the community and will stay for 2 to 3 days. This dedicated team of health professionals can all speak the local languages, many of them coming from these areas, which helps immensely to gain acceptance of the clinic and in teaching health issues. After a long and hard-working day, the team relaxes with the only luxury available.